Good afternoon. Thank you all for joining us today for our COVID-19 update. At the outset of the vaccination effort, San Diego County, we set a goal to move with speed. We set a goal to, as quickly as possible, administer as many vaccines as we could. Rapidly and quickly administering vaccines helps us as we come out of the pandemic. When you have a raging wildfire and you can remove fuel from that fire, you can help significantly lower the danger and lower the ongoing difficulties and challenges that we'll face. And so we set a goal to move as fast as possible. And I believe in many ways we have done that, and we have done relatively well. If you go to the state of California's website and you look at the total dosages administered based on population, out of the largest counties in California, we are right at the very top, just barely behind Contra Costa County and the number of dosages that have been administered based on population for the largest counties in California. And that is a testament to a lot of incredible hard work, incredible partnership with many of our health systems, county workers that have moved heaven and earth to stand these sites up rapidly, and the public that has been patient as we understood that speed was our goal in terms of getting vaccines administered. We also now have 19 total sites across San Diego County that we are running, administering, working in partnership with others. Those sites now have the capacity and potential to do 20,000 vaccinations, more than 20,000 vaccinations a day, every single day. The problem that we have now is our efforts have far outpaced the supply of vaccines. With moving forward what we have in inventory and what we are looking at and what we're doing in the days ahead, we will only be administering about 10,000 per day at these locations. Again, one half of the capacity of what we could do because we have just gone beyond the supply of vaccines. I don't think the supply of vaccines is anyone's fault. The feds can only allocate to the states what they have. States can only allocate to counties what they have. And as a county, we can only give what we have received. But the supply of vaccines has not kept up with our ability to build out infrastructure to administer them, and we hope that that changes in the near future. The good news for San Diego County is, in addition to being at the very top in our state of dosages administered, we have the infrastructure in place. So if those supplies increase, we are poised and ready and can quickly ramp up. Right now, we can do more than 20,000 a day. We think in a week or so, as we continue to plan out infrastructure, we'll be able to administer more than 30,000 per day. But again, the limiting factor here is the supply and the availability of vaccines, and we continue to hope that that changes. In a minute, I will walk you through a map of where our sites are right now. Our 19 sites, again, are 8 county pods, 4 partner pods. We now have 4 super stations up and running, and then 5 programs we're doing with county fire and rural or harder to reach efforts. And those, we think, all give us an opportunity to go. We will be meeting all of the scheduled appointments, but again, the appointments, we're only going to make appointments available for vaccines that we know we have or we are confident are coming. And so the great frustration the public has is, why can't we get more vaccines? We keep going to the website, there's no appointments, there's nothing there. We don't want to cancel an appointment. And so we're only going to release and make appointments available as we have a high degree of confidence that we can fulfill them. Over the course of the last few days, I've had direct conversations with Governor Gavin Newsom, with Secretary Galley, with Yolanda Richardson, with the CEO of Blue Shield, doing everything we can to ensure that they understand our situation, and I think that they're doing everything they can to support us. We did draw down an extra 5,000 vaccines in addition to what was being sent to help get us through, and that is helpful. And I really want to commend our county staff who are going through every vaccine shipment that has gone out to a location, calling those folks, what is your plan to administer them? How can you ramp up that plan to administer them? If you don't have a solid plan, can we take them back? Because we have the ability to do it. Dr. Wooten has been leading that effort and working with all of our healthcare system providers who are getting vaccines. And so we want to continue to see us move forward, and we want to continue to be as efficient as possible. But there is some encouraging news in terms of what we've done in the county and the position we're in. And again, we will make it work better and make it more convenient and make it more seamless. But the original goal and mission was to get as many shots in arms as quickly as possible. We will continue to do that. I also will share you an update in a minute about our long-term care facilities and skilled nursing facilities. There are about 1,300 of those in San Diego County, and these are being reached via a mix of CAL FIRE Operation Collaboration, a joint effort of multiple fire agencies, some work that the City of San Diego Fire Department is in the process of standing up, and work that pharmacies are getting moving. Out of the just over 1,300, 911 of these facilities to date have had their first dosages begin to be administered. And so we are making good progress in getting through these long-term care facilities, and the rest of them are scheduled to receive their first dosages. And so we think that is an important part. Another issue that's come up recently, and we've worked hard as a board to make clear as a county that we will respond via the issue of health equity, is some concerns about the who is receiving the vaccines. And I think it's important to note that right now we've done healthcare workers and we're doing seniors 65 and older. That demographic looks much different than the demographic of the county as a whole. And so what you see on the dashboards around the demographic breakdown in large part does reflect the demographics of healthcare workers and seniors in our county. But we want to do more, and we're going to be launching a number of very targeted programs to ensure those communities that have been hardest hit are able to receive the vaccine. And Supervisor Vargas will walk you through some of those efforts and programs that we are putting in place now that will help. And we also continue to increase staffing to support 211 in their efforts, so seniors who do not have access to a computer will be able to call and talk to a person. Again, the limiting factor is the availability of appointments, but we are making significant increases in the number of people who are there and able to take and answer a call. So with that, let's jump into our charts here. I'm going to walk you through a few of these, and then we'll hear from Supervisor Vargas, and Drs. McDonald and Wooten are here for Q&A. What you see here on the COVID dashboard is the total dosages shipped to our region, and then the total dosages that have been administered. You see first shot and second shot. And again, we know 357 is what we're reporting on our total dosages. We know the state database has us over 380,000. We know that the number is north of the 357, but we're working to increase the speed at which those numbers reflect. The delta that you see between total dosages administered and total shipped, some of that reports things that have been shipped, perhaps not received, or things that are being held back for scheduled appointments that are coming in the coming days. But we expect that total dosages number to increase. We know that it is significantly higher than what's represented there. But again, a considerable step forward. 10% of our population 16 and older have received at least their first dosage, and 2% of our population 16 and older are fully vaccinated. And again, as the supply increases, we will be able to increase those. Let's go to our next chart. What you see right here on the map is just the location of the current county and partner pods which are in place. You will notice that most all of them now we have opened up a considerable number. We have 2 of them that are future ones that are coming, one that is developing in Escondido, and then one that's coming in the North Coastal area, and those are ones that should be coming on within the next week. And then what we'll really be doing is just standing poised and ready to increase the throughput at each of these sites. Again, we have about double the capacity to administer vaccines that we actually have vaccines in place. Next slide. This is just the long-term care facilities. Again, you see just over 1,300. 911 of those facilities have received at least their first dosage, either through our partnership with our fire departments or through the partnership with the pharmacies. And we know that hundreds more are scheduled, and we think that we will be able to get through all of those in the coming days. Next, we'll go to our cases. Again, a second consecutive day below 1,000, and this is encouraging. You got to go back to the end of November where we had a single day under 1,000, and so we are encouraged by this trend. But again, we want to remind the public we have new, more contagious strains that are out there. And this is not a time where we can lose our focus. We need these numbers to continue to come down. We want to descend into the red tier. We want to get more things open, more opportunities for our community, make it easier for our schools to open, for our kids to get back playing sports and our small businesses. So this should motivate us to really double down on what we are doing and continue those efforts so that we can continue this downward trajectory. But the combination of being on the leading edge of number of vaccines administered and the decline in cases should give us a sense of hope that things right now are headed in the right direction, but a hope that motivates us to do more, not less. Next chart. Again, hospitalization numbers, these are going to lag the decline in cases. We know that there is a lag until we see that, but generally speaking, trending down ever so slightly day over day. And I know this is welcome news to our hospital systems to have those COVID numbers continue to trend down very, very slightly, but again, trending in the right direction. Next. The ICU capacity, you see, the box right there is staffed and immediately available, and people say, why is this not moving given the cases are coming down? And again, as the COVID ICUs took up a greater share of available ICUs, non-COVID ICU had procedures delayed or rescheduled, and so now our healthcare systems are going to be for a while trying to catch up a backlog of a lot of those things that we're able to delay, and so we don't think we'll see much considerable change in this number, even though we are headed in a better direction overall with cases and generally with COVID-related hospitalizations. And then, unfortunately, we report today 54 additional fatalities ascribed to COVID-19, brings our total to 2,683. And our final chart here just shows where we are in the tiered system. Again, you see that both the unadjusted case rate and the adjusted case rate are both trending down. You can see our unadjusted case rate from just a few weeks ago in the middle of January was at almost 90, then it was over 90. We've now cut it down to 50. The adjusted case rate, again, takes into account the testing, and we continue to do more than average number of testing, so we get some credit on the adjustment coming down, our percentage of positive also coming down, and our health equity testing percentage positive coming down. But you also see that we've got a ways to go to get down to that next tier in red, which is why we continue to stress with the public that we really have to be mindful and follow all of the advice that's out there. So bottom line, good news on vaccines in terms of our ability to get shots in arms, good news on the direction of our cases, but that should motivate us to remain vigilant and continue the positive direction of motion. And again, on vaccines, the limiting factor is just the supply and availability of vaccines, and we hope that increases very soon, and when it does increase, we are well positioned to be able to immediately ramp up the distribution of those. With that.